Okay, welcome everyone. Thank you for joining us to today's webinar. Today we have with us Ingrid Mitchell. She is a licensed bilingual English and Spanish social worker employed with the CIAD. CIAD is the Center of Excellence for Alzheimer's Disease. Primary role in the CIAD is to ease some of the caregiver stress by making connection in the community through by sharing resources. So we want to welcome Ingrid. So I don't want to really quickly go over PSS, and I did a quick view on our attendees today, and I know most of you know about us. But if you have any question regarding our services, please reach out to me. So we help caregiver in the community. And also we help family members dealing with a loved one who has Alzheimer's and any type of Alzheimer's and dementia. So we can help you. Please reach out to you can visit our website at pssusa.org/caregivers, or like I said, reach out to me. Again, my name is Shayna Jacques. I'm the outreach manager at PSS. So the email that came to you, you can just email me back from there to have any other information regarding PSS. And quickly, I just wanna remind everybody how important it is to participate in the census. It will help funding for the next 10 years. It only takes 10 minutes to do so. By doing so, you're gonna help with hospital funding, school, roads, transportation, and all. It only takes 10 minutes. Please count everybody in your house, your mom, your dad, family member, foster children, anybody in the house. And thank you. So without further ado, Ingrid, you can start your share now.
Thank you. Can everyone see it okay?
Yes, we can see it.
Great.
If you want to
Awesome.
make it has a slideshow, you can just, it will be better for everybody to see it.
Okay, let me just do that real quick. Sorry, my computer is a little old.
Yeah, that's okay.
So she takes a little time to warm up.
That's okay. So if you, yes, you can do that.
Got it? Awesome.
Yes, perfect. Awesome.
Great. So again, thank you for having me. I really appreciate this opportunity to share all of this awesome information with you. It is a lot of information, so I want to um, be as courteous and as careful as possible. If you have any questions or concerns, just please let me know at the end of the slide. Thank you. So, my name is Ingrid Mitchell, and I am a bilingual social worker, and I'm working currently for the CIAD. The CIAD is the Center of Excellence for Alzheimer's Disease. The purpose of the CIAD is to identify how healthcare practitioners interact and collaborate in the care of persons with dementia, working with caregivers, multiple family members, Medicaid versus Medicare. What are patients with Alzheimer's dementia entitled to in New York City? So a little bit about the CIAD. Columbia University Center of Excellence in Alzheimer's Disease offers diagnostic evaluation, treatment, care management, and follow-up. Evaluations including dementia subspecialist, clinical interview, and neural examinations. These examinations may include MRI, single photon emission computed tomography, SPECT, computed tomography, as CT scans is what we usually know it for, and detailed psychological testing. What does collaborative care consist of? So collaborative care consists of basically we get together, of course, with the patient, the caregivers, and any family members that are part of the patient's care. So daughters, sons, sometimes even a neighbor can be part of the patient's care as long as it is legal to do so, and that the patient has given us consent to talk to anybody in their care. The social worker will receive referrals from providers. These referrals will consist of anything from helping the families identify resources in the community. Resources like what? Oftentimes families come in and they want to address home care needs. For example, they need a home health aide. So therefore, they'll call the social worker. The social worker will provide these connections, so assist with these connections. So assist patient, family member, caregiver with concerns and identify in the community and connections within home care services as a like a home health aide, physical therapy, that's PT, OT, occupational therapy, nursing, etc. Hi,
Ingrid, I don't know, can you push your your mic a little bit down because
can you hear me?
and then can you speak a little bit louder because people are
Gotcha.
asking.
I didn't want to
Yes,
yell
now
into
it's
the
good.
mic, but I'm. This is this better?
Yes, yes.
Oh, awesome.
Thank you.
Great. And once again, caregiver supports. And if you have any, if you know of anyone experiencing memory loss, you can contact our CAD. The number is provided there and also the web address um, for our CAD, 212-305-2316. It's our phone number. So what to expect during your medical visit? Definitely, absolutely, please, share your concerns with regards to memory and behavior changes. Oftentimes, I find that the patient, in fact, will not remember and usually downplay symptoms. And when the doctor will ask, the patient usually will say, I'm fine. So therefore, we count on the caregivers or family members to share with us what exactly is it that they're seeing, any memory issues, any behavior changes are highly important, is something that you should share with your provider. Patient and family involvement in treatment is imperative. Again, referrals to social workers are made during this time when either the physicians or the family members have some concerns. So the caregiver, the physician will identify some issues with care or issues with additional, if the patient needs additional supports, this is a good time to refer to the social worker. And again, the social worker would then reach out to the patient and or caregiver, assess for needs, educate on benefits, and make referrals as necessary. So with regards to benefits and entitlements regarding Medicaid, Medicare, and or private insurance. Medicaid, what is Medicaid? Your benefits are often tied to what insurance you have. Medicaid, Medicare, private long-term care. And what is Medicaid? Medicaid is a public assistance health program for low-income Americans regardless of age. To be eligible for Medicaid right now in New York City, your income could be no more than $875 a month. For a couple is $1,284. Medicaid provides coverage for medical appointments, neurological diagnostic evaluations, and home care. It also provides for round-trip transportation for medical related appointments. Um, so meaning to and from round trip, meaning from your home to your medical appointments and back. Any medical appointments. So dentist, eye doctor, your neurologist, cardiologist, dermatologist. So any medical appointments are covered through Medicaid for these services. What else does Medicaid cover? Covers long-term care, meaning Medicaid covers um, home health aides, physical therapy, occupational therapy, registered nursing, etc. It also covers home nursing, adult daycare programs. It offers very limited assisted living coverage because most facilities do not accept Medicaid. But recently, trying to assist a patient, I found that New York City Lot and Village Care both accept Medicaid and they're both located here in the city. Medicaid and managed long-term care plans. Home care can be provided by managed long-term care plans, which is a system that helps streamline your services. You will be connected to what's called a care coordinator. And this care coordinator will assist you with um, scheduling doctor's appointments, scheduling for transportation, MLTC, managed long-term care. MLTCs also provide support to you and your family for long-term care, again, in the form of home care services, home health aides, social workers, registered nurses, etc. Oftentimes I get asked why choose the MLTC, and so again, one of the reasons why you would choose an MLTC is because your services will now become streamlined, and in the hopes is that it'll be easier for you to identify things that you can benefit from, and hopefully the care coordinator can help you address those needs. There are three types that you are asked to choose, and I will go through them in a little bit. Medicaid, Medicare, MLTC. So you are asked that you must choose a plan if you have both Medicaid and Medicare. If you need home care and adult daycare or other long-term care programs, that's it. If you need care for more than 120 days, you are asked to choose a plan. Age restrictions, you are 21 and older. The three types are MLTC Medicaid, MLTC Advantage Plus, and MLTC PACE. One thing that I did want to mention is that if you do not choose a plan will be chosen for you. I think it is imperative, highly important, that you sit with your family members or friend or somebody who's either familiar with your needs and go about choosing a plan together. I definitely recommend that you talk to either your primary care physician or the social worker in the social worker within that unit that probably knows you and your care um, just as much as you, so that you can choose a plan, so that you can choose a plan together. If you don't choose a plan, one will be chosen for you. And what I find is that if one is chosen for you, maybe your primary care physician is not involved in that plan, and then you would have to switch primary care physician. And oftentimes, people want to keep their PCP or their primary care physicians. So moving along. Oopsie, what's happening? As a plan member, you are free to keep seeing your Medicare or Medicaid Advantage doctor or other provider of services not covered under the plan. Okay, so going to the PACE plan. You have to be, did I just skip something? I'm sorry. I sure did, I'm sorry. Choosing a plan. As a plan member, you are free to choose your Medicare and Medicare Advantage doctor or other provider of services covered by the plan. MLTC Advantage, you must also join the plan's Medicare product. You choose a primary care physician from the plan to be your regular doctor. Oftentimes, your doctor already is part of this plan, so that's not too difficult, and they cover everything. So basically, all your current care, your primary physician are all involved in this one Advantage Care plan. Again, I ask that you please talk to your physicians about this, just to make sure that you're not switching physicians when you switch or choose a plan. The program for all-inclusive care for the elderly is called PACE, PACE program. You must be at least 55 years or older to join PACE. PACE health services are provided by a team that includes doctors, nurses, social workers, and others. An example of a PACE program is center-wide, meaning that in this program, everybody is there. So you basically go into the center and let's say, for example, I have a patient who said, I don't like to be home alone, so I choose a PACE program because all of my plan's adult day center, it's inclusive. So the adult day center is there. They spend the day with their doctors and providers and nurses. So you go from your home to the center, and everything that you need for your care is already in that program. Center Light on 99th Street in Manhattan offers a very similar program where everything is included. Food, your home health aide accompanies you there, or you have a home health aide assigned to you within that program. You can get more information on the Medicaid's website. I've included it here. And just as a note, undocumented patients can also be awarded Medicaid for life-saving conditions such as chemo and dialysis, including transportation. So all of this is covered under Medicaid for life-saving conditions. The phone number is provided there as well. If you don't already have Medicaid, you can be eligible for Medicaid. You can find out if you are eligible for Medicaid by going on that website. It's called Access NYC. I've included it here. If your income is above the Medicaid's max or the Medicaid threshold, there are still ways in which you can become eligible for Medicaid. A good way of doing this is, again, contacting your primary care physician when you're at a visit with your primary care. Ask, they would probably refer you to the social worker like myself, and so that you can discuss this with the social worker or another provider in-house. Your insurance carrier is another resource that's often neglected. At New York Presbyterian, at Columbia Hospital, New York Presbyterian, we have the New York Legal Assistance Group. Somebody's there representing the group who also assists with these in these situations, not just these situations with insurance, but also with speaking about attorneys, speaking to attorneys about veterans' rights or Medicaid and Medicare issues, Social Security, disability, retirement, and other concerns. So, in order to become eligible for Medicaid, as mentioned before, you have to make under the Medicaid max. There's two ways of becoming eligible for Medicaid. One is the spend down, and the other one is the pooled income trust. I must admit that these both are exceptionally tricky to understand. I'll try to make it as user friendly as possible. So we'll start with the spend down. The spend down is basically you are paying into Medicaid, you're over. So if you make $900 a month, that's your total income. You will pay Medicaid $25 a month to then be allowed to receive Medicaid services, which opens up to all of these different services. If you make more money than that, that can easily add up to a lot of money a month. So let's say, for example, so even if your income is higher than Medicaid's level, you can still get Medicaid spend under the spend down rules. So basically, you subtract the your monthly income and you pay it into Medicaid so that Medicaid can now you become eligible. Um, so the pooled income trust, oftentimes it is recommended for people who make, of course, a lot more money than, let's say, $900. If your income is $4,000 a month or $5,000 a month, that's a couple. This is probably better to do the pooled income trust. And within the pooled income trust guidelines is created to avoid spend down payment. And so basically, how do you apply for it? You need to have medical documentation that states that you are disabled. You will apply for Medicaid and you accept the spend down and then request to rebudget all of this. You don't do this on your own, you get somebody to help you. I definitely recommend, again, that you speak to your primary care physician, the social worker in-house. Usually they would already have done this before with somebody and will be able to recommend um, services for you or somebody who can help you. This trust can be used as a legal loophole alternative for individuals, allowing them to qualify for Medicaid when their income is too high. This is still for the trust pool. So instead of giving up your income to Medicaid to become qualified for, this money is deposited into an account. So you also choose the agency that you want to handle this spend down. You cannot touch this money. Once deposited, the money is used towards your expenses and bills. So what bills, the agency bills, your light bill, your mortgage, your rent, your phone bill, food, all of this is handled by this company that's handling will be handling your expenses. The agency you select will pay your bills for you using the money that has been deposited into your trust account. Bills like I said, your rent, your mortgage, utilities, your phone, cable, groceries, credit cards, etc. The goal of the pool trust is to utilize all the money before the end of the month so that you can become eligible for Medicaid. You do not lose this money. The money that is not used is not lost. It goes on to the next month, so it's rolled over. It can be terminated at any time for any reason. If the trust is terminated, such as when someone passes away, the remaining balance cannot be dispersed to family members. Families A family does have 90 days to use the money towards individual past bills. If funds still remain after 90 days, it can only be donated to a charitable cause in the individual's name. It is not kept by the organization, nor does Medicaid keep it. The pool trust organization has minimal fees. There's a one-time enrollment fee of $250, an annual renewal fee of $100, and a monthly maintenance fee equal 10% of the individual surplus at a minimum of $30 a month and at a max of $250 a month. That is a lot of information to take in. But again, you are not alone. Please, please, please discuss this with, if you're seeking help at the CIAD, where I'm at, so you would seek help from me, or you can speak to the social worker or the doctor that is following your care for more information on this. And there's a step-by-step guide in this web address. In a New York Health Access offers a step-by-step guide applying to pool trust. It is very lengthy, and even for most professionals, sometimes it could be a little confusing. If you already have home health aid, oftentimes these home health aid agencies are connected to legal aids, lawyers, of course, social workers, and that can offer to assist you further. For Medicare, federal government-sponsored health insurance, to be eligible for Medicare, it's 65 and over. You have to be a legal citizen of the United States. Medicare provides hospital coverage. Outpatient medical visit coverage is optional, and medication coverage is also optional. Medicare also provides coverage for diagnostic workup for neurological degenerative diseases such as Alzheimer's, dementia, up to 100 days per calendar year for inpatient stay in skilled nursing facilities or rehab. It also offers short-term healthcare needs, less than 120 days, for example, to be connected to a nurse or physical therapy. Usually, I've seen this happen when somebody leaves the hospital after a chronic condition and to be followed up with the referring physicians will contact a home health aid agency, and these services are provided for 120 days. If the patient needs more care afterwards, then a discussion will happen between the caregivers, the patient, and family members and providers, and so that another plan can happen so that care can continue. So continuity of care is important. Medicare does not cover long-term care needs. Medicare does not cover assisted living facilities, and Medicare does not cover nursing homes. To get an application for Medicare, I provided the website below. Home care agencies. There are thousands of home care agencies in the city. To select one, I definitely recommend that you speak to your doctor the clinic social worker. I often, we're not connected, let's say, for example, to a social work agency, but um, I have, let's say, a top three agencies that I always go to, and why. I find that they say the agencies that I usually pick are responsive to phones. They are responsive to, they answer phones, the phones when I call. They are responsive to patients. Patients usually give great recommendations, so I tend to keep them. So again, don't feel like you're alone in choosing a home care agency. Of course, you can Google search them and find if they have complaints or not. But oftentimes your primary care physician or the clinic social worker will be a good source to help you choose the best home care agency for you. And again, you're not locked to a home care agency. You can also always choose others. So once you have selected a managed long-term care plan, you can choose a home care agency. Choosing a home care agency and consumer directed personal care assistant program, CDPAP, has become really popular these days. And choosing that's when choosing a family or friend to act as a home health aide and gets paid for it. Types of home care: Medicare and private insurances will cover short-term home care services on a very limited basis. As mentioned before, skilled need of nursing care or physical therapy can be covered. Patient must be homebound, must be seen within 60 days of prescribing doctor's care. Doctors only can order short-term care, home care. Agencies that provide care, for example, are Visiting Nurse Services of New York is one of the agencies that provides home care services. Home care orders will be sent to physicians every 30 days for recertification. Um, Good resources to have, and I often find myself um, giving this number and web address to the caregivers for anything for anything Alzheimer's related. Just recently, I referred somebody to this number because they were looking for um, groups, support groups in New York City. Every state has a chapter, so definitely call the Alzheimer's Association to find out which chapter is closest to you. So, New Jersey, New York, Massachusetts, they all have a chapter. So you can call this number and find which one is closest to you. I also called recently about the medical alert system. They offer a discount for family members if this is something that you're interested in as well. They offer educational workshops and trainings. Another good resource to contact, and I find myself contacting them a lot, not just for Alzheimer's dementia, but for people 60, 55 and above, 60 above, oftentimes. So they offer good resources on senior centers, completely free of charge for all people to attend, for seniors to attend, provides low cost lunches. Oftentimes, these centers offer transportation to and from their center. Um, these are often housed in churches and synagogues. They offer daily activities such as yoga, nutrition, classes, educational programming. They also offer help for caregivers. So to assistance in locating a center, you can contact that web address. New York Connect is another one, and they are located throughout the city. They also offer tons of resources with regards to long long-term care supportive services. Care management, I think, is very important, not just so much for the patient, but for the caregiver. Um, the caregivers are often feeling overwhelmed with caring for a loved one. So having somebody that they can call and help them assess uh, or identify benefits in the community, this is something that a care manager can do, and you can find one through New York Connect. They offer caregiver supports, and they're located throughout the city. Caring Kind, very similar as well to the Alzheimer's Association, are available 24 hours a day, 7 days a week, and you can contact them again for tons of resources. They also, like the Alzheimer's Association, also have a Wanderers program, and they early stages services, monthly educational seminars and trainings, a vast network of supports, individual and family counseling sessions with licensed social workers. The different offices that are located for support here in the, I live in the Bronx, and in the Bronx we have Neighborhood Shop. In Brooklyn is JASA. In Manhattan it's the New York Foundation for Senior Citizens. In Queens is the Self-Help Community Services. Staten Island has Community Agent for Senior Citizens. There are also benefits, of course, for veterans. Administered by the Department of Veteran Affairs. There's their web address is linked here, and the phone number and extension specifically for the services. Patient must be a veteran or veteran spouse, widow or widower, child, or significant other. Further eligibility may be determined based on cause of disability, character of discharge, period of service, and length of service. Medical benefits include adult daycare, long-term home care, hospital care, and nursing home care. Accessing nursing home services for your loved one. Again, this is something that you would need to discuss with your primary care physician. Oftentimes, primary care physicians will make a suggestion, and things to they would start the conversation. Have you thought about a nursing home for your loved one? Their level of care is one that is above something that can be provided at home. So the decision is made by patient and or family member together with the family member. At a nursing home, 24-hour care is necessary and around-the-clock care. You definitely would have to choose a facility that offers dementia care, that has a dementia care unit. Getting into a nursing home, of course, requires medical history. The cost of a nursing home, tips for paying for nursing home are available in the Alzheimer's Association's website. And it is also important to speak to a lawyer regarding power of attorney, assets, asset allocation, and property. Hospice care versus palliative care. Both are patient-centered specialized program of care. Both offer medical diagnosis, both require medical diagnosis of a chronic disease. There aren't any age restrictions, and they're both centered at improving the quality of life. Provide support, physical, emotional, social, spiritual, to help manage symptoms. And they're both paid for by your insurance. Both hospice and palliative care provide in-home care. They're on call 24 hours a day, 7 days a week, and the care is provided by interdisciplinary team, which consists of oftentimes a nurse and a social worker. The objective of both is to control and manage pain. They have limited home health aid coverage, extensive at-home equipment, meaning if you are eligible for either one of these programs, something like a hospital bed that would oftentimes cost money would be covered under your insurance if you are found eligible for hospice and palliative care or palliative care. Referrals to either one of this have to come from your medical notes or hospice agency. One of the agencies that I usually again refer to is Visiting Nurse Services of New York. Specifically for hospice, focuses on pain management, not treatment. So therefore, it is an understanding that the life expectancy is less than 6 months. There aren't any age restrictions. In-home hospice is covered by all insurances, including Medicare and Medicaid. It is recommended that you bring up concerns about your memory with your provider at home hospice, and it is also provided at institutions. Palliative care is focus is on pain and symptoms and symptom management. Sorry, a patient does not have to be terminal. May still be seeking disease-directed treatment. It is not limited to reimbursement, meaning it's covered by your insurance. Moving on to home delivered meals. A lot of the Department of the Aging, offers assistance with getting home delivered meals. The senior centers in your community offer assistance with home delivered meals. In-home delivered meals, you must be 60 and over. They provide either fresh or frozen meals. You must be homebound. Other ways to locate an agency is to go on the citymeals.org website, type in your zip code, and you will be taken. It will help you navigate um, what agency is offering home delivered meals. Also, your clinic social worker can help you with that as well if you don't have technology available to you. Transportation services, very important um, to get to and from your medical appointments. So transportation is service offered through Access a Ride. You can ask your clinic social worker. I oftentimes find myself calling that 877 number and sending the application to a patient's house or I will assist the patient complete the form. And later on, we will send it together, and paratransit will schedule an appointment with the patient to go to their facility to get assessed to see if, in fact, they are eligible for services. So, transportation through Access a Ride, paratransit on-demand service within the 5 boroughs of New York City. It is for disabled patient, may bring spouse or caregiver, like a home health aide. This is not a taxi service, and oftentimes they may pick up other customers on the way when need to. I've provided here the MetroCard bus and van locations. You can fill your card in the locations, and they're scattered throughout the city. And to apply for MetroCard half fare, that's available to you as well. Of course, it's available for people with disabilities and senior citizens. Medicaid transportation in New York City, only for Medicaid recipients. Medicaid transportation is it's only eligible for Medicaid recipients. Medical answering service, that's the number you call. I offered this as I plugged in the web address and the phone number. This they've done some changes, and this is now only the social worker or somebody else who's been assigned to take care of this, usually at the hospital or your local clinic, will do this for you. So they're not asking actually patients to call in themselves. They require that you speak to your provider. Providers have a form that they will complete, they will fill out for you, and start these services. And again, these services are available for Medicaid, and they are available for undocumented people who have been diagnosed with chronic medical, they have a chronic medical disease such as dialysis or chemotherapy, where they too can get transportation services to and from their life-saving medical appointments. There is required paperwork. Please don't fear. You have your friendly social worker who can help you fill them out. And so an M11Q is needed for home health care services. Again, this is something that your provider and your social worker, your in-house social worker completes. And we either give you the paperwork back, or we send it out to your local insurance carrier. Your insurance carrier then will either assign you we'll give you the home health care services that you requested, and This has to be completed within 30 days of your last medical appointment. So you have, let's say today is June 19th. So between June 19th and August. Between June 19th and July 19th, that's the threshold that you can submit an M11Q for home health aid services. Form used to justify home care necessity. So your doctor will complete that. They'll specify why you need home care services. Medical and physical limitations are helpful to put down. Assistance with your ADLs, such as cooking, shopping, household responsibilities, duties like light cleaning is covered. Like I said, must be completed within 30 days of your medical appointment. It has to be signed by both the patient and the physician, um, and provide complete form to either patient or your managed long-term care plan, like Fidelis, Affinity, Health First, Metro Plus, which are some of the most popular ones. These are just some of the forms. Um, a lot of these forms, I'm really glad that you can grab them online these days. The one on your left is the Visiting Nurse Services form. I use this one to request for hospice care. I use this one also to request, services such as social worker, home care services. And your doctor, the physician will complete a portion of it or agree. I usually complete it and the physician will agree to it and we submit it to visiting nurse services. The one on the right is the medical request form. This is what's called the M11Q. Over here you have very important patient's contact information, diagnosis, medication, and the reason why the physician agrees to home care services. This transportation form is usually called the 2015 form. Like I said, this is not being used as often anymore, but I like for you to take a look at it because these are still the same questions that you will fill out when you do the online form. These forms are done by somebody who's been given a username and password, like myself, and is being followed at your clinic. Like I said, most of these forms are downloadable, which is awesome. You can just keep a copy on your computer. M11Q, Visiting Nurse Services of New York, the 2015 form are now done by providers and agencies that are given access. If you are a provider, contact Medicaid Answering Service as the number that I'm providing below. Wheelchair is ordered through a durable medical equipment supply company. Medicare requires chart notes, not letters of medical necessities. Patient's mobility needs not met with a walker or rollator. Patient's home is wheelchair accessible. Patient has upper extremity function and can self-propel, unable to ambulate on his or her own. Transport wheelchair is a lighter wheelchair that folds up, requires some documentation as above with additional statement that caregiver is willing and able to provide assistance with the wheelchair. Power wheelchair is something that is highly requested and it's really difficult to get. The patient has long-term need for wheelchair and cannot manually do it on their own. Many hospitals and rehabilitation centers have interdisciplinary clinics that assist with this. So what I find is that your primary care physician will, as you will request one, your primary care physician will then provide a referral so that the patient can be seen by in the rehabilitation center. They will in turn assess for needs and then write a prescription. If they find that that the patient needs it, they will write a prescription. They would write a prescription and then provide it to the insurance company or the durable medical equipment company um, to see if you actually need the wheelchair. Power scooters, for the most part, are not covered by insurance. Facilities should provide documentation to the physician and or nurse practitioner to sign for insurance coverage. Always refer to clinic if unsure of eligibility, as determination can be made. Again, the one who makes determination of whether or not you can benefit from this would be in a rehabilitation clinic, where you would have a physical therapist, occupational therapist assess for needs. Hospital bed is another thing that is not so many oftentimes requested, but every once in a while it is, and is very tricky. Your doctor has to not just find that you need it, but that you will be safe in it. So just because you think that, or I'm sorry, just because a caregiver thinks that a patient might need a hospital bed doesn't necessarily mean that the hospital bed is a safe option for the patient. So please, please, please discuss this with your provider. So hospital bed, all insurances, including private and Medicare and Medicaid, only cover semi-electric hospital beds. Supporting documentations or letters of medical necessities, depending on insurance, are required. Patient requires frequent changes in in body position, or an immediate need for change in position. And patient's condition requires positioning of the body to alleviate pain or avoid respiratory infection. Patient requires head elevation more than 30 degrees due to heart failure or pulmonary disease. And pillows and wedges have failed. So the insurance company want to know basically that all of these things have been tried before they even make a decision to say that they will pay for a hospital bed. Things like commodes, canes, shower chairs, walkers, and rollators do not require any supporting documentation besides a script. So if and when you're confused about equipment, speak to your clinic social worker, like myself, your primary care physician, and someone or someone in rehabilitation medicine. But like I said, usually your physician will make that referral, especially when you're working in a hospital. That's what I found. If you're working at a hospital, your physician will make a referral to rehab, and in rehab they will assess for needs and and make that prescription or the script. Both your medical doctors can order any type of equipment, but the need must be justified. Oh, I am coming to the very end of this very lengthy presentation with lots of information, but I have included here additional resources from A through Z. I'm hoping that you can just click on it, copy and paste, and find the information that you need. If not, then I'm hoping that you can speak to your trusty social worker at your individual facilities.
Thank you, Ingrid. So that was very interesting and a lot of information, like you said.
Yeah.
So some of our participants asked, can we share the slide? So
Yes,
if it's okay
absolutely.
with you, you can send it to me. I will share it with them.
Absolutely.
So, okay. And then one thing that we needed to, mention that I know Lisette Lover from Alzheimer's Association, she's on the line with us. She
Yeah.
just mentioned that one of the number needs to be updated, the one that you sent to us.
Which number is that? Yeah.
It's just, she said the helpline, the 24-hour one, it's 1-800-272-3900.
Nice. Thank you. Is that
Thank
the
you,
Alzheimer's
Lisette.
helpline?
Yes,
Awesome.
the
Thank you so
24.
much. Yeah.
I know.
That's
Uh,
awesome. Thank you.
thank you again, Lisa. And also somebody posted some information about the chat. Karina Subia, if you want to share your information with us, with the community, we don't mind that, but we don't want anybody to just go and ask question. or just call the number if they're not sure about the services. So if you want to present to us with the community, our community, it's helpful resources. So we open to do so. But if you want to share your information, please reach out to me first before you do that. Thank you again. We have some question on the Q&A. Can you see them?
No, I can't.
Okay, so let me go back and read them to you.
Okay.
That's okay?
Yeah.
Okay, so Naya, N-I-E, if I'm pronouncing your name wrong. So she asked about, okay, let me just read it. Quite a few assisted living program in the city accept Medicaid, but the question is whether they have dementia care in the facility, and even they charge over $10,000 a month. Oh, she was just making a statement. Okay.
Yeah, yeah.
Okay.
Yeah, absolutely. So I had to call one of the agencies that I spoke about earlier, and they were able to facilitate which ones, and yes, completely correct. It's not just right. So do they offer dementia care is one, and do they accept Medicaid? So the numbers become smaller, right?
Yes. So the look back period for Medicaid home care is changing in October. Do you have any suggestion on how can lobby against this change?
The look back period.
The Medicaid home care, it's mentioned that they're going to change it in October, and the look back period. So Janet is asking, do you have any suggestions for how we can lobby against this change?
I would definitely just go back and contact the Medicaid offices. So what I found, I will call them about everything. Questions about Medicaid, why are you doing this and that? So the number I provided there, even their web address, and I've actually, especially during this, I'm sorry, this election period, don't be shy about contacting your local representatives. They're there for us. So please don't forget to vote. Don't forget to sign your surveys, and definitely speak to either the Medicaid office entirely, or speak to your local representatives. Absolutely important.
Okay, yeah, that's important. So especially like you said, it's especially right now in the election time, and it's always good to go vote too. That's important. And also the one in office now can definitely help us and just make sure changes or advocate for us. Okay, so Susan, if your cardio doctor is with Medicare, can you still use him for Medicaid?
So yes, you can, but be sure that they both are accepting the plan. Sometimes, unfortunately, one accepts and the other one doesn't. Contact them both. Make sure that they both accept it. I'm sorry, that's all I have for that.
Yeah, it's good to check on both. I would definitely say that. We don't have any other question. Let's make sure. Okay, so thank you again, Ingrid.
Thank you for having me.
Very
I
much. So she will send the slide to me, and I will share it to some of you that asked for it. Just as a reminder, it will be best if you guys email me. Just let me know you need the slide, and I will just send it to you because I might not remember everybody that asked for it. Okay. Again, thank you and have a great day. Bye-bye, everyone.
Thank you. Thank you very much, everyone.
Thank you. Bye-bye.